Coming up on the Doctors Hospital podcast.
On a daily basis, besides the attacks of pain in the joints and anemia, they can also have swelling in the hands and the feet.
Over the last 10 to 20 years, we've made huge advancements in the management of patients with sickle cell disease.
Doctors Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6 Terrace, and discover quality, compassionate healthcare at Doctors Hospital Specialist Clinic.
Welcome to the Doctors Hospital podcast. I'm your host, Alexis Burrows, Marketing Director at Doctors Hospital. I am pleased to be joined today by two individuals who are closely connected with the fight against sickle cell, or the fight to manage sickle cell disease here in the country, as we are celebrating and recognizing World Sickle Cell Day. I'm joined by Dr. Rudi-Ann Graham, who is a pediatric hematologist oncologist, and Tamara Clarke, who is a board member of the Bahamas Sickle Cell Association. Welcome to the show, ladies.
Thank you so much for having us.
Thank you and good day.
All right, and so we are looking forward to a very interesting and informative conversation on sickle cell, where people can get to understand about the disease, how it works, some of the options that are available to them for treatment, management, how you go about diagnosing, that whole process. Again, especially in light of today, the day that we're recording, being World Sickle Cell Awareness Day. So I want to start off, for our listeners who may not be aware of what sickle cell is, how it works, can you just give us a brief overview of what sickle cell disease is and how it affects individuals?
Okay, so sickle cell disease is an inherited blood disorder marked by defective hemoglobin. It inhibits the ability of the hemoglobin in the red blood cells to carry oxygen. So sickle cells tend to stick together, blocking the small blood vessels, causing painful and damaging complications.
Okay. Okay. So what does that manifest for patients in terms of what does that look like if someone has sickle cell? What kind of I guess impact does that have on their daily life?
So I think I could chime in on that. So as Ms. Clarke said, sickle cell disease is inherited, meaning you get it from your parents, right? A person who has sickle cell disease, the actual disease itself, has to have two abnormal copies of the gene that codes for hemoglobin.
Okay.
You have to get one from each parent. So that actual full-blown sickle cell disease looks a little bit different in a patient with that disorder versus somebody who carries a trait, who is normally healthy and just carries one abnormal gene from one parent. As she explained, because of the abnormal hemoglobin, if you remember from biology, hemoglobin is that thing that carries the oxygen around the body and delivers it to all your organs. If you have that abnormal hemoglobin, your red blood cells become abnormally shaped. Normally they're round and donut shaped and very flexible. But in sickle cell disease, they become, under certain precipitating conditions, become sickle-shaped or C-shaped. And these red blood cells don't bend very well, and so they block the blood vessels, especially the smaller blood vessels to each of the organs. And so what this generally manifests as is commonly pain. That's often the most acute symptom that patients with sickle cell disease can have. They can have either acute or chronic pain, and this pain can happen in the joints, in the bones, along the chest, in the abdomen, and so that's the most frequent complication. Patients with sickle cell disease live with chronic anemia. Their hemoglobin levels are lower than the average. And so they're often tired all the time, more fatigued easily. And with this anemia also comes that characteristic jaundice, that yellowing of the eyes that you often see with patients with sickle cell disease. Similarly too, because of the blockage of these vessels with these red blood cells, it leads to a lot of end organ damage. So a lot of patients end up with kidney disease, liver disease, heart disease as a result. And there are other complications like infections of the lungs, serious blood infections, a whole variety of things that patients with sickle cell disease have to live with simply because their red blood cells are a little bit deformed.
Right. So it's a pretty exhaustive list of potential complications that come out of it.
Right.
What are some common misconceptions about sickle cell disease that you encounter in your work?
So for me, there are a few common misconceptions that I've seen regardless of where I've worked. A lot of times sickle cell disease is said to be associated only with Black people, which I think is a common misconception. I mean, of course, here in the Bahamas and wider in the Caribbean, most people are Black. Most people are of African descent. And sickle cell disease did arise in sub-Saharan Africa. And so patients who have descended from persons from West Africa are most often the ones with sickle cell disease.
Right.
But having practiced in other places such as Florida and New York, I've come to realize that sickle cell disease is not only a Black person disease. There are a lot of patients who are of Mediterranean descent, who have ancestors from India, who have ancestors from other areas of the world, the Dominican Republic, Cuba. And so you see a lot of Hispanic patients and other races that have sickle cell disease, full-blown sickle cell disease. So I think that's one of the common misconceptions. The other thing that we've encountered too commonly is that sickle cell disease patients, when they complain of pain, they don't look like they're in pain, so they must not really be in pain. And so we miss opportunities to treat these patients properly and address their actual pain. But I think what we have to remember is that this is a daily thing. A lot of patients with sickle cell disease live with chronic pain. And so their pain tolerance tends to be a lot higher than the general public.
Because they have a longer and a larger experience with pain.
Right. They've been living with pain all their life. So when they come into the emergency department and they're like, oh, my pain is 10 out of 10, but they're not balled up and crying as we expect, I think it's important for us to recognize that they may have a higher pain tolerance and still take the patient seriously and treat their pain adequately.
You know, the pain tolerance thing is an interesting one because I know that's come up, I think, when we had our conversation about women's health. And it's an interesting, that's a separate conversation to have. But that concept of if you have a higher pain tolerance, how interacting with the medical system, how challenging that can be at times because if you're thinking 10 out of 10, the idea is this person, like you said, is balled over in pain. But if they have a high pain tolerance, they may be sitting there looking very normal, but still in excruciating pain. And so it's an interesting thing to navigate.
Right. And I think this also contributes to the stigma that surrounds a lot of patients who come to the hospital for help for managing their pain. We look at them and they look like they're not actually in pain. And so we think, they're drug seeking. Or this is a frequent flyer to the emergency department. They're always here. Well, they're always in pain. And so it's important for us as physicians and as a wider community to be aware of this so that we can adequately address person's
because
pain.
You may have some people who might be drug seeking, but how do you navigate knowing what you're dealing with and being really attentive to the details of an individual patient?
Right.
So you mentioned this, I think, in more of a direct scale, but I guess from a global perspective and maybe even just regionally in terms of variations, what is the prevalence of sickle cell disease, whether globally or locally? And are there any differences in how it presents in our region as opposed to maybe other regions? Because I know sometimes people have mentioned how with breast cancer, for example, with the BRCA gene, we tend to have a much more difficult time and a more morbid experience, generally speaking, with it here than maybe in other places in the world and other races. Is there anything similar like that when it comes to sickle cell?
So as we had said before, sickle cell disease is an inherited blood disorder, but we didn't say that it's the most common inherited blood disorder. And so worldwide, there are about 500,000 babies born with sickle cell disease in 2021. Most of these babies were born in sub-Saharan Africa, but we do have a major contribution to that number coming from the Caribbean. outside of West Africa, the Caribbean has the highest number of sickle cell disease cases. There were studies that were done in Jamaica that looked at a few territories, a few islands in the Caribbean. And based on that, we have determined that about 10% of patients in the Caribbean in general carry at least a sickle cell trait. In the Bahamas, we don't have any recent studies with those sorts of numbers. We're now starting to gather information from our newborn screening program on what the actual prevalence of sickle cell disease is in the Bahamas. There are a few older studies though from the 80s which would say that the prevalence of the sickle cell trait is similar in the Bahamas. About 10% of persons, of Bahamians, carry the sickle cell disease trait. But those numbers now are likely to see changing now that we're screening more for sickle cell disease.
Gotcha.
In terms of the presentation, it's pretty similar across the board. As I said, pain, infections, organ damage, stuff like that. What you might find is that in different regions of the world, because you have contributions from confounding genes like a thalassemia trait or a sickle cell C trait or something else inherited along with that sickle cell disease, the manifestation may be a little bit more severe or a little bit less severe depending on what combination of abnormal hemoglobin genes you have.
Right.
But a lot of the presentation is similar.
Okay. So what are some of the primary challenges faced by individuals living with sickle cell disease? I know you mentioned fatigue, pain, things like that. Is there anything else that we didn't cover in that initial part of the discussion about what sickle cell, what people facing sickle cell have to deal with on a daily basis?
Well, on a daily basis, besides the attacks of pain in the joints and anemia, they can also have swelling in the hands and the feet, bacterial infection, dizziness, stroke, and even for long-term pain, they may, as they get older, they develop long-term pain.
Right. So as Ms. Clarke said, those are a lot of the complications that we see. I think it's important to recognize that sickle cell disease can manifest very early, as early as infancy. You can have children as early as 4 to 6 months developing symptoms of sickle cell disease. Most commonly at that time, the presentation is what we call dactylitis, as you said, painful swelling of the hands and feet. Some children can get into trouble with their spleen being enlarged and severe anemia from those cells being trapped in the spleen. And because over time, their spleen doesn't function well, they have severe bacterial infections if they're not adequately put on the right medication, the right antibiotics, and given the right immunizations. And as you get older, the chronic pain and the acute painful events, these unpredictable, severe painful events, what we call the vaso-occlusive crisis, those become more prominent in sickle cell disease. And then similar to that, you can have what we call it's almost like a crisis in your chest, what we call acute chest syndrome, which is typical. It's basically a pneumonia, but because of the physiology of sickle cell disease, it's a little bit more complicated and difficult to treat. And it's treated differently from a pneumonia, and it can be a life-threatening complication. As Ms. Clarke also said, strokes are a big thing that we look out for in sickle cell disease. It's one of the most common complications or most devastating complications. I think it might be weird to think of a child who is 2 years old coming in with a stroke, but important to remember that sickle cell disease is one of those things that can increase a child's risk of developing stroke. And it looks similar to an adult stroke, but we treat it a little bit differently. And so these are always things that we keep in the back of our mind when managing and monitoring our patients with sickle cell disease.
Okay. You mentioned that it can start to manifest in patients as early as 4 to 6 months. Is there any meaningful difference in the impact of sickle cell disease on pediatric patients versus adult patients? And that's in terms of both medical management as well as quality of life.
Right. The main thing here is to remember that if you have sickle cell disease, you are born with that disorder.
Mm-hmm.
And so the manifestations can occur very early. And so for us as doctors, as physicians, the best way to improve our outcomes in patients with sickle cell disease is to start to put in place those preventative mechanisms to stop the early manifestations of sickle cell disease if we can, the early complications of sickle cell disease.
Mm-hmm.
So early diagnosis is key. And then early patient education is key, so that the parents of these individuals or these babies born with sickle cell disease know what to what complications to look out for, and know when to seek medical care. There are things that we put in place, like preventative medications like hydroxyurea, which have been shown to decrease complication rates in children as young as 9 months with sickle cell disease, and certain special vaccinations that patients with sickle cell disease get, certain prophylactic antibiotics that they're placed on. All of these things we implement early to improve the overall outcomes of patients with sickle cell disease.
Okay. All right. So one more question before we take a quick break. What advancements have been made in the treatment of sickle cell disease in recent years, and what are some of the more promising areas of research?
Right. So this is a big one. So I think over the last 10 to 20 years, we've made huge advancements in the management of patients with sickle cell disease. I think one of the main things, the mainstay in sickle cell treatment that we've used over the last couple of years is early institution of hydroxyurea, which, as I said, is a medication that patients take by mouth, which has been shown to be disease modifying in sickle cell disease. It decreases the painful crises, it decreases the chest infections, it decreases the need for blood transfusions, and it decreases overall hospitalizations and improves quality of life. And so it's been shown to be effective in babies as young as 9 months, but I've had patients as young as 6 months who I start on hydroxyurea even before they develop complications of sickle cell disease, just to improve their overall outcome. In resource-rich countries, it's the mainstay of treatment. Everybody's on hydroxyurea.
Oh, wow.
And so that's one of the biggest things that we have, biggest game changers that we've had in sickle cell disease over the last couple of years. There are other medications that are coming out now, like L-glutamine and stuff like that, that are not so much mainstay, but that we may add to hydroxyurea therapy. Those are newer emerging things, and those also too have been shown to be effective in children. But I think the biggest thing that we have come across in the last couple of years is that we now have a cure for sickle cell disease. There are two main things that we can use to cure sickle cell disease. One is what we call a stem cell transplant or a bone marrow transplant. And what this process is that the person who has sickle cell disease, we replace their bone marrow, which is the bone marrow is the place where all the body's blood cells are made. Their bone marrow is replaced by the bone marrow of a healthy donor, usually somebody who is genetically matched to them, usually a sibling or a family member. And so that enables them to make healthy red blood cells and essentially cures their sickle cell disease.
Oh, wow.
It's not without complication, and of course it's not available to everyone. It's not yet available here in the Bahamas, but certainly in other settings outside of the Bahamas, it's readily available once there's a match. And then the biggest thing I'm sure everybody heard about was gene therapy, which is the new kid on the block, recently approved by the FDA in December 2023.
Oh, very recent.
Yeah, so we're using now gene therapy to actually cure sickle cell disease, which allows us to modify that abnormal gene that creates that abnormal hemoglobin and causes your body to produce functioning red blood cells. It's expensive. It's not widely available to everybody. I mean, gene therapy can cost as much as $3 million
Oh, wow.
for one patient. So obviously it's not available to everyone, but the important thing about it is that for persons who don't necessarily have a match and are not able to undergo a stem cell transplant, this makes a curative therapy available to them, because you don't necessarily need somebody to match with you to do gene therapy.
That's definitely not something I was aware of in terms of the curative options that now exist. We're having a great conversation with Dr. Rudi-Ann Graham and Tamara Clarke, talking about sickle cell disease and sickle cell awareness. We'll take a quick break and we'll be back here on the Doctors Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctors Hospital podcast. We are continuing our conversation on sickle cell awareness with Dr. Rudi-Ann Graham and Ms. Tamara Clarke. So moving into more of a conversation about the importance of awareness for something like this that impacts so many individuals in our community and across the world. Ms. Clarke, can you talk about the importance of raising awareness about sickle cell disease, especially, we're recording on World Sickle Cell Awareness Day. So can you speak to that importance?
Yes. So June 19th is celebrated as World Sickle Cell Awareness Day. And September is used as our month for sickle cell awareness. Every year globally to spread information about the blood disorder and we highlight the challenges faced by people suffering from it. The importance for us in raising sickle cell awareness is because that day usually emphasizes the need for improvement, for patient care, for access of treatment, for ongoing research, and it also helps us to gain more knowledge and to keep updated with new information, which might help to avoid complications of sickle cell anemia in patients.
Okay. So what support services are available for individuals and families affected by sickle cell disease, both locally and globally?
Well, locally, we have the Bahamas Sickle Cell Association that involves our WhatsApp support groups, where we keep that updated with everyone that may be hospitalized, whether you're sick in hospital or at home. Also, we have persons from all of the family islands that are also a part of our WhatsApp group. So we keep check on them as well. We also have a team that goes hospital visits. Hospital visits, yes. So we go and we show support during the hospital visits. Let persons know that you are here for them. Also, persons needing medication. The association also assists with that as well. And we also offer one very important thing, which is prayers, which is a mind soothing for a lot of persons, and it's very good for the soul. So every month we have an education meeting addressing significant topics relating to, warriors to help improve their lifestyle. So as we keep our WhatsApp group updated, daily, that helps with, keeping the awareness group going for each and every person who don't know.
Right. It's interesting. I imagine that even just WhatsApp as a platform has made the availability of support so much greater than it's been in the past. I know, especially coming, through the pandemic and out on the other side, having had family members who've gone through a lot of health challenges and looking at that availability, like I said, I imagine that's a great boost to being able to provide support to families and individuals who are navigating managing the disease. I understand that you yourself have 2 kids who have sickle cell disease. From your perspective, how important is that support? And then what advice would you give to other parents who may be navigating that journey of being a parent with, a kid or multiple kids who are navigating having sickle cell?
Well, the advice I can give is, as a parent, I currently have 2 boys who are sicklers SC. One is 9 years old and one is 21.
Okay.
So they are very, far apart in age. And they basically have a lot of the same symptoms that, I'm prepared to see, because I've already known from the first one what to look out for in the second one. So with them, they have, like Dr. Graham mentioned earlier, sicklers usually have a high tolerance for pain. So, for example, my oldest son, who's 21, sometimes he will be in pain and you would not know. It have to get, to a devastating point where he's like, I have to go to the hospital.
Right.
And when he says it, the last time, I think it was about last year, June, when he said that to me, and I was like, do you really? And he was like, yes, so we went there and he was really in pain. They took about an hour to get to us. And then by the time as they got to us, one of the nurses was like, okay, we have to check the frequent flyer list. This is after an hour.
Oh, wow.
So what I tend to do is to avoid a lot of that. I keep everything in my house. So
all
down to the pain medication, down to the heating pads. They have their warming blankets. And, so I try to keep a lot of things. I think the only thing now left for me to do is just learn how to hook up the IV. So basically I try to keep everything on hand.
Right.
And if I know they're having physical education at school, I tend to give them extra. Dr. Graham, don't get me for this, but I pack them up. I tend to give them extra so that when they have PE, and they won't be as tired or feel any pain. So at least when they come home, if they are fatigued and out of it, they then can just take a bath and lay down. So it's a lot of, home remedies we as parents can do to keep our children, from a little pain-free. Not all is going to be pain-free. Not all of the, attacks are going to be pain-free, but as best as we could.
Right. To allow you to manage it in a way where, like you said, especially because Dr. Graham mentioned it about this idea of frequent flyers or drug seeking and things like that. I imagine as a parent with kids, you want to avoid that type of experience in the hospital, because your mind, first and foremost, is this is my kid. And the tolerance for someone saying, this is just a frequent flyer or this person is drug seeking is going to be very low. And so I get it. From that standpoint, you want to keep them, that has to be an absolute necessity, because the nature of engaging with it. And, it's kind of one of those things where you understand it from both sides. But it's still, it's an awkward thing to manage. And so I imagine trying to keep them out of that unless it's absolutely necessary is kind of a part of it. The heating pads, the whole thing, I think that's good too. And again, giving people an opportunity to kind of hear some of the, like you said, the home remedies, the ways that you can help to treat. Obviously, if your kid is in a full-on crisis or you're in a full-on crisis and you have to go to the hospital, by all means, go. But if there's ways that you can manage it and limit the interaction with the health systems, I think that's also, advisable.
Okay. Yes. And also, I tend to also meet with their teachers, because that plays a very important part, because basically they're at school all day. Now, the 21-year-old is out of school, but the 9-year-old, I tend to meet with all of his teachers, let them know exactly, what it is, what it's about. So once he's there, I can at least keep an eye on him. Do not let him get dehydrated. If he's playing physical education and he said he's very tired, he needs to stop, and so forth. So it's very good to also help educate the teachers.
Very much so.
Because I had a teacher who told my son to take off his jacket because every time she looks at him, he makes her hot. So I had to, that's why I'm saying
that
it's
conversation.
very, very important, because their body temperatures are very different from a normal person. So you could be hot, they could be cold, so education is very important as well.
No, and that's why even, for us, it was, important for us to have a conversation like this, especially around this time. And I would encourage anyone who's listening, when this comes out, be sure to share it. If you have friends in the education space, family members, obviously, who may be recently diagnosed, who have a kid who's recently diagnosed, send this on to them, because there's a lot of information here that can kind of help you in managing and navigating the whole concept of having it or being a parent of someone who has it. One of the things that will always come up in a conversation in the healthcare space is the barrier of socioeconomic status. So, how do socioeconomic factors, including access to healthcare and education, influence the experience of individuals that are living with sickle cell disease?
Well, children and adolescents with sickle cell anemia have socioeconomic limitations and worse nutritional conditions. When compared to reference populations, these limitations may lead to worse growth and greater occurrence of possible complications that can impair their quality of life.
I agree. So, as Ms. Clarke said, patients with sickle cell disease, as we know, we discussed all the complications that we have of sickle cell disease. They need increased access to medical care, whether it's just their routine visits with their primary physician or their hematologist. They have increased screening requirements. They need increased blood tests. They need head ultrasound scans, MRIs, all these screening things. And then you have, when they develop the acute complications of pain and infections, and the need to go to the hospital and to the emergency department. So it can be quite expensive to engage with the healthcare system that frequently. And so it's a financial strain often on a lot of patients and parents. And this, because of this fact, a lot of patients really sometimes wait until the very last minute to try to engage the healthcare system, or they don't follow up as routinely as they need to because it's so expensive. And so with that, if you're not getting the comprehensive care that you need, it increases your complication rates and decreases your overall quality of life. So I think the disparities exist. And so it's important for us to try to address these things, either through patient and parent education, and just having these support systems in place for patients with sickle cell disease to have earlier access to care.
So for you, Dr. Graham, as a pediatric hematologist oncologist, what are some unique challenges in providing care for pediatric patients with sickle cell disease, especially as they, transition from childhood into adults, and that transition of care from being a child and adolescent and then into adulthood?
Right. So I think for adolescents, with teenagers, I think living with sickle cell disease, it can be a very difficult situation, a difficult transition to make. Certainly when you're a child, when you're under 10, even under 15, your parents are the ones who are taking you to the doctor's visit, taking you to the hospital. And when you start to get to 18, 19, up to 21, okay, now it's your primary responsibility to make sure that you're getting the health care that you need, preventative stuff and the acute management stuff. And so that can be a lot. That can be a lot for an adolescent to take on. And so what I find is that during that transition period, the adolescent and young adult, we find that we have a lot of patients who are lost to follow up. They just don't end up going to the adult doctor at all. And so they just don't get any help. They don't get the health care they need. And we have a lot of patients who also become non-compliant with their routine medications. And so that in turn increases the complication rate. And so what we try to do to counteract that is to start this quote unquote transition period a little earlier, even as early as 12 to 13 years, so that they get in the mindset of what the adult world is like. It is very different from the pediatric world. Like, nobody is going to call you and tell you to come for your follow-up. So we try to get them in that mindset, and hopefully by the time they reach to 18 or 19, they're ready to take it on their own.
Yeah, I imagine, again, you're talking about something that is an ongoing every
day, every time you see them, there's a counseling session. Very important.
Yeah. All right. So as we wrap up, I'd like to ask both of you actually to answer this last question. And that is, given that, it is World Sickle Cell Awareness Day, what message would you like to convey to our listeners, especially regarding the importance of advocacy and support for individuals living with sickle cell?
Okay, so if you are originally from the sub-Saharan Africa, African American, Asian, Indian, Mediterranean, or Hispanic, chances are that you or someone you know has the sickle cell trait or sickle cell disease. The Bahamas Sickle Cell Association has been highlighting the need to have our communities know their sickle cell status, which is so very important. Sickle cell screening is free under the National Health Insurance once your primary care physician refers you for testing. Knowing your status is not the end of the world. It gives you the power to make an informed decision and/or better manage your condition if you have sickle cell disease. We are continuing our advocacy for the introduction of newborn screening of sickle cell disease here in the Bahamas. If you have never thought about testing for sickle cell disease, take that deliberate move and ask your primary care physician for an electrophoresis test, which will give you the results for knowing your status.
Awesome.
How you can reach us? You can reach the Bahamas Sickle Cell Association by our Facebook page, Bahamas Sickle Cell Association. We have an Instagram page, Bahamas_sickle_ASSN. Our website, bahamassicklecell.org. Our phone number is 817-2355. We have monthly meetings for the Bahamas Sickle Cell Association every last Thursday of every month. So I encourage warriors to listen, share your story, and help spread awareness. So to all you warriors throughout the Commonwealth of the Bahamas, just know you are beautiful, you matter, and you are awesome.
I second that wholeheartedly. Know your status. Ask your physician about testing. If you know you're becoming a parent soon, it's a simple blood test to know if you carry the sickle cell trait or not. And when the baby is born, ask your physician about the newborn screen to detect sickle cell disease. Early intervention and preventative management is key and improves overall outcomes.
Awesome. So I guess to add to that, what we do have currently running here in Doctor's Hospital is a discounted price for the sickle cell screening test. So for adults and kids, it's $17 plus VAT. And this promotion runs until the end of the month. No appointment or physician referral required. And you can get this done at any of our outpatient collection sites, which include Doctor's Hospital West on Blake Road, Doctor's Hospital at the Mackey Street Plaza, formerly Meldon, the Dalzell Medical Center, Carmichael Medical Center, Centerville Medical Center, or in Grand Bahama at the Cavala Medical Center in 8 Mile Rock, and at the Exuma Medical Center in Georgetown, Exuma. So we are offering discounted rates on the screening tests during the month of June. So if you're listening, and like Dr. Graham said, if you are about to be a parent, or your kid is going to be born soon, or if you think you may have the possibility of having a trait, now is a good time to get tested. And again, we're going to probably come around and do another conversation about sickle cell again in September as a part of Sickle Cell Awareness Month, and just do a deeper dive into that space. But I want to thank you both for joining us today on the Doctor's Hospital podcast. This has been a very engaging and informative conversation. And again, we invite you, as always, to like, comment, share, and subscribe. I want to thank you both for joining us, taking time out of your busy schedules.
Thank you so much for having us. It was a pleasure.
All right. So again, we encourage you to like, comment, subscribe, and share. And we will see you here next week on the Doctor's Hospital podcast.
When accuracy, efficiency, and simplicity matter, choose Doctors Hospital Laboratory Services. We are the premier outpatient laboratory service in the Bahamas, delivering timely results you can trust. Experience the ease of testing with us. Accurate, fast, and hassle-free. Doctors Hospital Laboratory Services, where precision meets convenience. Give us a call at 302-4759 to get started today.